My name is Wam. I'm a nurse in Cameroon, and I'll be presenting on the topic the use of task shifting in the implementation of prevention of mother to child transmission of HIV, as PMTCT services in Cameroon, and will be based on the experience from option D plus. For a brief summary, mother to child transmission of HIV is the greatest contributor to HIV in children, and it has been found to be contributing to about 90% of new infections in children. And effective implementation of prevention of mother to child transmission of HIV services has been found to reduce the rate of vertical transmission, that's from mother to child, to below 2%. And this paper seeks to demonstrate the fact that nurses, if they are given the proper training and knowledge, they can effectively intervene in the prevention of mother to child transmission of HIV. For this small illustration, we see that mother to child transmission can be described like water running through a tap, and the source of the tap being the infection in the mother, and then the outcome, that's the infection that gets to the child, being the flow at the other end of the tap. And just like a tap, we can see that closing the tap can reduce or can actually prevent the flow of water at the other end, and this can happen in many ways as far as mother to child transmission is concerned. If less risky deliveries are conducted, and less children are exposed to breast milk, and also the mothers being placed on antiretroviral therapy, can greatly reduce the transmission from mother to child, and nurses have a role to play in all of these steps. So vertical transmission rates for HIV can be up to about 40% if no interventions are given to the mother. But however, these rates can greatly reduce to below 2% if interventions are provided and if nurses are empowered to do so. So what's the problem? Limited skilled personnel and inadequate antiretroviral therapy centers in Cameroon has greatly reduced the uptake of PMTCT services, and Cameroon at the time of this paper has just about 166 approved HIV treatment centers in the whole country, and the doctor to patient ratio is not very good. We have just one doctor for 10,000 persons. That's in the urban areas, and and in the rural areas it is even worse. We have one doctor for 40,000 persons. But the situation with nurses is just a bit better, with 16 nurses for 10,000 patients. So all of this has greatly affected the effectiveness of the PMTCT service in the country. So in 2012, the World Health Organization recommended option B plus as the better strategy for prevention of mother to child transmission, and Cameroon adopted this recommendation in that same 2012, and we started implementation in 2013 October. Just for information, option B plus is an option that entails that every woman who tests positive for HIV receives antiretroviral therapy for during the beginning from the pregnancy to the end of their life. They take it for the rest of their life. And before 2013 in Cameroon, the decision for a person to be placed on antiretroviral therapy was based just on medical doctors and in a few centers. So in 2008, the World Health Organization equally recommended tax shifting as a solution to solve the problems of staff shortage in resource limited settings like our country, Cameroon. And task shifting just simply refers to the delegation or the shifting of tasks or of duties from a more skilled personnel to a less skilled personnel, that is in this case from doctors to nurses. And methods. This study was a cross-sectional study covers the period 2013 from October to December 2015. And the data presented was collected from existing reports and literature that has been written on this subject, and also from national activity reports from the National AIDS Control Committee of the country. And results: at least from 2013, at least 2 nurses were selected from each of the 22 pilot sites. These are health facilities in 2 regions in the country, and trained for a period of about 5 days. And from October 2013 to July 2014, these nurses that were trained enrolled a total of 600 pregnant women and breastfeeding mothers on lifelong antiretroviral therapy in 22 health facilities, call them sites. And the hypothesis for this study is that if nurses can be provided, the nurses can actually provide antiretroviral therapy if they are given the right training. So the preliminary results that we got from this pilot study prove that it is actually successful, that nurses can actually adequately provide antiretroviral therapy, and this set the pace for the country to scale up the services in the country. And as time went on, by December 2015, a total of 520 nurses had been trained in the southwest region of Cameroon. That's just one of the 10 regions in the country. And over 1,754 women receive antiretroviral therapy to help them prevent mother-to-child transmission of HIV. That's just in one region of the country. And this has shown that nurses can actually provide antiretroviral therapy, and task shifting is very effective in this service. So the next step for this study would be to compare the viral suppression rates and the transmission rates between clients who were enrolled and followed up by nurses with those that were enrolled by doctors and followed up for PMTCT within the same period, to see whether we can establish any remarkable difference between the transmission rates in the two groups. And we have the references here. And in conclusion, I want to say that the best available prevention for the spread of HIV is treatment with antiretroviral therapy for those who are positive. This has been seen to be very effective, and task shifting enhances data coverage and increases